Welcome to Living a Balanced Life with Julio. On today's episode, we're going to talk about diabetes. So what diabetes is, the types of diabetes that are there, some of the symptoms, some of the risk factors, and the way we can manage diabetes. So if you're interested, please stay with me. So let's get started. So what is diabetes? Diabetes is a disease, a condition where your body is not producing enough insulin, or that the insulin that your body is making is not working properly. So there's two problems. You don't produce enough insulin, and the insulin that your body makes doesn't work properly. And insulin is a hormone, and its job is to help regulate your blood sugar. Most of our body function depends on our insulin working properly. In order for us to use the energy from foods that we eat, it depends on how well our insulin is working or how much insulin is being produced in our body. High sugars, of course, is not good for you because our body works in a balance. So whenever the balance is tipped off, that's when disease starts forming. So high sugars can cause damage to the nerves, to the blood vessels, and they can cause organ damages. So it's important for our body to work in a balance. So with diabetes, the balance is tipped off because your body is either not making enough insulin, or the insulin that your body makes doesn't work properly, and we call that insulin resistance. So there are three major types of diabetes. There's type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes used to be called juvenile onset diabetes because most of the time the people that were diagnosed with type 1 diabetes were much younger. So most of the time was people under 20 that were getting diagnosed with type 1 diabetes. And with type 1 diabetes, what's happening is that your body does not make any insulin at all. So when you eat, and the energy from the food cannot be used properly, or you cannot use the energy from the food properly because you don't produce any insulin from your pancreas. So for people with type 1 diabetes, in order for them to regulate their blood sugar and to prevent damages in the body, they have to take insulin before each meal, so they can utilize the sugar or the energy from the foods. Then there's type 2 diabetes. Type 2 diabetes used to be called the adult onset diabetes. Same reason, because most of the people that were diagnosed with type 2 diabetes were mainly above the age of 18 or 20, right? But of course, nowadays with the way things are going and kids not being very inactive, and there's lots of video games and a lack of physical activity, a lot of kids are getting diagnosed as well with type 2 diabetes. So with type 2 diabetes, your body starts off from making some insulin. So you do make some insulin, but you don't make enough, and sometimes the insulin that your body makes doesn't work properly. So you are making some insulin, but you're not making enough to handle the sugar load and to help regulate your blood sugar and to help prevent the complications that high sugars can cause. So with type 2 diabetes, you start making insulin, but it can come to a point where a person is not making any insulin anymore, and they have to take insulin as well as taking oral medication and with lifestyle management to control the blood sugar. And then you have gestational diabetes. Gestational diabetes is a type of diabetes that happens to women when they're pregnant. So when a woman is pregnant, there's a insulin resistant increase, meaning that how the insulin is working, it's not working as properly as it's supposed to be, due to the volume and the baby and all of that. So gestational diabetes happens to women when they're pregnant, and usually when a woman is pregnant, around 24 to 26 weeks, the doctor will send them to have blood work done and to have oral glucose tolerance tests done, where they give you something sweet to drink and to see how your body is able to handle the sugar load, to determine whether you have gestational diabetes, or your body is able to manage the sugar and regulate the blood sugar like it's supposed to. So that's gestational diabetes for pregnant women. So those are the three types of diabetes: type 1, type 2, and gestational diabetes. So what are some of the risk factors that put a person at developing type 1, type 2, or gestational diabetes? So with type 1 diabetes, is an autoimmune disease, meaning that your body produces antibodies against the cells that make insulin. So it's like essentially your immune system is attacking the cells that make the insulin in your body that helps regulate your blood sugar. So it's an autoimmune disease. So it's not at the fault of any the person. You wouldn't know that you have it until symptoms start to develop. So with type 1 diabetes, the risk factor is just the fact that the disease is autoimmune and that your body produces antibodies that work against the insulin cells. With type 2 diabetes, there's both factors. So the genetics plays a role, meaning if you have a family member that has any type of diabetes, it increases your risk. If you're someone that are obese or carry your weight around your abdomen, increases your risk because that causes insulin resistant. If you're a person that belongs to the African descent, Hispanic, Latino, people of Asian descent, all have a higher risk of getting type 2 diabetes. If you're someone that's inactive, so someone that doesn't do any exercise at all, it increases your risk. What you eat plays a role. If you're someone that consumes large amounts of carbohydrate or sugary food, that can put you at risk combined with other risk factors, right? So these are some of the risk factors of type 2 diabetes. So these all plays a role, and it's not one thing that leads to the other. It's a combination of multiple risk factors that puts a person at risk of developing type 2 diabetes. Risk factor for gestational diabetes is just like type 2 diabetes. Is usually around when women are pregnant between 24 to 28 weeks. They'll go for their blood work to see where they're at. Like most pregnant women goes through this test just to determine where you are in terms of whether your body is able to tolerate the pregnancy, able to make enough insulin to help you utilize all the energy from food, help regulate your blood sugar to protect the baby and for your health as well. So around that time, if you do blood work and you usually they give you something sweet to drink, check your blood sugar around after drinking that for about an hour, and then sometimes 2 hours mark. So you drink it, they check your blood sugar before, an hour after the drink, and 2 hours after the drink, and that tells us how your body is able to deal with the sugar load that's put in your body. And if you're someone that have a family member that has diabetes, your risk increase. If you're someone that carry large babies, it causes your risk of gestational diabetes to increase. And of course, having type 2 having a family member with type 2 diabetes also puts you at risk of increasing your risk of getting gestational diabetes. So that's the risk factor. So for type 1 is autoimmune. So some of the tests that your doctor can use to find out where you're at in terms of whether you have type 1, type 2, or gestational diabetes, like I talked about earlier, is blood work is one of them, and then also oral glucose tolerance test. So with blood work, for especially someone with type 1 diabetes, because it's an autoimmune disease, blood work will be taken, and then the antibodies that is developed against the insulin cells will be looked for. So they will look for that, and if that's present, then that's a way to show that the person have type 1 diabetes. Also, they go for blood work, random blood work, so either fasting blood work, so where you fast for 10 to 12 hours, and then you have your blood taken, and then was checking to see how your fasting sugars are, and also random blood work. So at any given time, they will take your blood to see where you're at in terms of the blood sugar. And combination of all those tests will let your doctor know that yes, you have type 1, and if or type 2 or gestational. So gestational, like I said, it happens between 24 to 28 months, where a woman that's pregnant will get blood work, and then based on the results after drinking the sweet drink, how your body is able to deal with the sugar load will determine where you're at. If you're at risk for a risk for diabetes, which is the intolerance, or if you are have full-blown gestational diabetes. And same thing with type 2 diabetes, you go for blood work. Another test that's usually that's been used commonly now is the A1C test, which is also blood work, where they check to see how your blood sugar has been for the past 3 months. So they take an average of your blood sugar, and that let us know where you're at in terms of whether you have diabetes, or you have pre-diabetes, or you have gestational diabetes, or where you're at in terms of your diabetes management. So most of the tests that's used to diagnose diabetes includes blood work, include a person fasting for some of them for 10 to 12 hours, and then comparing to see if a person can tolerate the sugar load that usually is through the drink that a person drinks at a lab. So that's how your doctor determines if you have diabetes. Of course, there are symptoms of diabetes. So if a person starts to show some of these symptoms, they it can be an indication for the person to go to their family doctor to say, okay, this is what's happening to me. Can you please check to see where I'm at, right? So, like I said earlier, type 1 is usually happen in younger population, but type 2 usually after hitting age 40, 45 going, that's when a person's risk increase. So usually around that time, your doctor will send you to go do blood work to see where you're at if you're not having symptoms, because people can have diabetes for years and not have not even one single symptom. So they wouldn't know that they have diabetes unless they get their blood work done. But some people does show some symptoms. So some symptoms of high blood sugars include being extremely thirsty, drinking lots of fluid, but still you feel very, very thirsty, peeing a lot. So if you're someone that's constantly going to the bathroom throughout the night all the time, that could be a sign that your sugars are high. Having dry mouth or dry throat, it could be a sign that your blood sugars are high. Some people, they feel extremely tired, they feel very fatigued and very lethargic. Those are all signs that something is wrong, could be your sugar. Because what happens is if your blood sugar level goes high, your body's trying to get rid of the sugar. So what happens is that because you can't pee out crystal sugars, you need water in order to flush the sugar out, right? So you're peeing a lot because that's your way, your kidneys trying to get rid of the extra sugar. So you're peeing a lot to get rid of the sugars, and because you're peeing a lot, you're dehydrated, so you drink lots of water, right? And it's like a vicious cycle. You're peeing, you're drinking, and it keeps going. Your mouth is dry because once again, your sugars are really, really high. And sometimes some people can have blurred vision. They might feel really, really tired. These are all signs that something is wrong. Like something is happening and that you need to take precaution. Having said that, just because some of these symptoms are there doesn't mean you have diabetes. It's just sometimes your body's warning you that something is wrong. So it's better to speak to your healthcare provider, do your blood work, just to see where you stand, right? Because at least then if you don't have diabetes, it clarifies that, because those symptoms could be signs that your blood pressure is high as well, right? So whenever you're feeling some kind of symptoms where, you know, it's not your usual self, have it checked out to find out where you are in terms of if you have diabetes or not, or to find out what the underlying problem is. So those are some of the signs of a person having high sugars. But like I said, but some people, they have no symptoms at all. So you can have some symptoms or you can have no symptoms. So either way, some people can live years in diabetes state, meaning their sugar has been high for a long time, and they wouldn't know. And of course, high sugars when it's just recent or it's been a long time, it's still damaging to the body. Like I said, our body works in a balance, and whenever the balance is tipped off, that's when disease can start to form. So high sugars can lead to heart disease, can lead to kidney problems, because like I said earlier, your kidney is trying to get rid of the sugar, and in doing that, your kidney is overworking, your heart is overworking, your pressure is increased because your body is trying to bring the balance back. And because this is something that your body cannot manage by itself without you putting some lifestyle changes or taking medication, it's hard for your body to handle all of that. So that's essentially the treatment for diabetes. So there's no cure for diabetes, but you can live a healthy, long life with type 1, type 2, or gestational diabetes while a person is pregnant. So some of the things that you do to manage your blood sugar is, of course, watching the amount of food that contains natural sugar, right? So some food contain natural sugar, and that's our energy food. We need them, but we need small amount. So those are your grains and starches, your milk and alternative, and then your fruits. So all fruits have natural sugar in them. They're good for you, but of course you have to watch the amount. So watching the amount of food that you're having that have natural sugar is one way of controlling your blood sugar, controlling your diabetes. Of course, exercising, because when we exercise, we're using up the extra sugar that's sitting in our blood as energy, right? So that's our energy. So the more we move, the better our blood sugar becomes. So essentially, exercise is very important for diabetes management, whether type 1, type 2, or gestational. Of course, sleep and controlling your stress is very important, because when we're under stress, our body releases hormones that makes us gain weight. Our body releases hormone that causes our blood blood sugar to go high because our body is trying to give us the energy we need to deal with the stress. So when we're stressed, our body gives us a lot of sugar to deal with the stress, and that of course in turn make our blood sugar go really, really high. And when you're not sleeping, your body thinks you're under stress and will release a lot of hormones that will cause you to gain weight and cause you your blood sugar to go really high. So managing your sleep, making sure you're getting enough sleep, making sure you are de-stressing is an important pillar of diabetes management. Of course, having said all of that, making sure we are taking our medication is very important too, because with diabetes, and everybody's diabetes is different. So for someone that has type 1 diabetes, remember, their body does not make any insulin. So for them, they have to take insulin before each meal. So breakfast, lunch, and dinner, and then bedtime, right? So you take 2 types of insulin, the rapid insulin that works to bring the sugar load from food down, and then you have the basal insulin that controls the blood sugar throughout the day, right, and helps control the morning sugar. So someone with type 1 diabetes, you manage it with lifestyle management, meaning watching what you eat, exercising, making sure you're sleeping, and then of course your insulin injection. And the insulin injection, it comes of course in an injection of a pen or in a pump, depending on what age and what's going on. Your doctor will work with you to determine what will be the best way of getting your insulin. And then you have type 2 diabetes. So type 2 diabetes, sometimes everyone's managed differently. So just because this person have type 2 diabetes and that person have type 2 diabetes mean they're going to do the same thing to manage it. That's not true. Everyone's different. So don't listen to an advice that someone like a doctor or a nurse or a diabetes educator have given to one person and apply to you, because everybody's different. We look at your blood work, we see what's going on, and then we come up with a treatment that fits your lifestyle to help you manage your blood sugar. So for some people, managing type 2 diabetes is with exercise and lifestyle changes. So exercising, making sure that they're eating a balanced, healthy meal regularly, and controlling their stress and their sleep. It's a way to manage the sugar. So some people doing that can manage the sugar and they're fine. And every 3 months you go for blood work to see how your diabetes is being managed and how the sugars have been. And then for some people, they will take oral pills. So because your body makes some insulin with type 2 diabetes, remember your body makes some insulin. So sometimes different medications are prescribed. They work on different parts of the body to help you make more insulin. So some of them make your muscle more sensitive to insulin, so you can use up the insulin that your body is making. Some of it works on the pancreas direct, where it helps you pump or produce more insulin to help deal with the sugar load. Some help with your incretin, so it helps with when food goes in your stomach, how your gut, how food is being digested and all of that. So there's different medication, works on different parts of the body to help manage type 2 diabetes, right? Type 2 diabetes can be managed with pills, but type 1 cannot. And then of course, as a person has diabetes over a long period of time, so having type 2 diabetes over a long period of time, some people, the cells that produce the insulin, the beta cells, gets tired and gets weak, and then some of it dies off. So it will come a point where a person can take insulin when they have type 2 diabetes, because essentially their body's not making any insulin. So then they have to put the insulin there. So type 2 diabetes could be managed with lifestyle management, with oral pills, with oral and combination of insulin, or with just insulin. It's whatever you need to control your blood sugar to prevent complications of diabetes. That's what you and your healthcare provider will come together and work with to help you achieve optimal blood sugar, to help you prevent the heart disease, the kidney disease, and high blood pressure, and all the other complications of of diabetes. So that's type 2 diabetes. For gestational diabetes, because by the time you find out that you have gestational diabetes, you're about 24 months to about 24 weeks to about 28 weeks pregnant. You don't have much time. So when you found out that you have high sugars, your doctor will give you about maximum 2 weeks to try and use some lifestyle changes to bring the sugar down, because we have to think about your health and the baby's health. So 2 weeks to do the exercise and the dieting to see how you do the lifestyle management. If that is not able to bring your sugar to target in 2 weeks, then you are put on insulin. So you're put on insulin to take, depends on how your sugar is and depends on your eating habits. You'll be put on insulin twice, 2 to 4 times a day, and then this to help you control your blood sugar, help your baby grow and thrive properly, and to prevent any kind of birth complication to the baby and to yourself. So that's how you manage gestational. Of course, what you're doing, taking the insulin, of course you're watching what you're eating as well, and you're doing some exercise in combination to help control blood sugar, so you can live a healthy life, and also have a healthy life for your newborn babies. So that's how you manage diabetes. I know it's a lot of information, but whatever diabetes you have, the best thing you can do for yourself is making sure that you are controlling your stress, you are getting enough sleep, you are exercising. So with exercise, 30 minutes, walking counts. 30 minutes a day is sufficient enough to keep your sugar in check. If you're someone that is obese, if losing a little bit of weight, losing 5 to 10% of your current body weight will help you get your sugar to target, to prevent the complications that's associated with type 2 diabetes, right? And type 1 and gestational diabetes. So because essentially whenever the balance is tipped off, the complication of type 1, type 2 gestational diabetes is the same. The nerve damages, blood vessel damages, organ damages, and it can all lead to horrible complications if not managed, right? Doesn't mean everybody that have diabetes goes through these complications. It's how you're managing. So with management, every 3 months you go for blood work, and with the blood work we're looking at your A1C. The A1C is a test, it's a blood test that tells us how you are able to manage your blood sugar, and how your blood sugar has been for the past 3 months. So for someone with diabetes, we want that number to be, and it's in percentage, less than 7%. So if your A1C target is less than 7%, that means you're managing your diabetes very well, and there's a minimal chance of developing complication. If that number, the higher the number goes, the higher your chance of getting complications. So A1C is like your check-in point to see where you're at in terms of how your diabetes is being managed. Of course, that's different from when you prick your finger. So when you prick your finger and you're looking at your blood sugar at this moment, and with that, before meal is different from after meal. So before meal, the sugar number is a little bit less, and then if you're going to check your sugar after meal, is 2 hours after meal, and that should be also a different number. So before meal, so fasting blood sugar or before meal blood sugar is anywhere between 4 and 7 millimoles per liter. That's the target. If it's there, that means your blood sugar is being managed well. And then 2 hours after you eat, if you want to know how the food affected your blood sugar, 2 hours after you eat, you check anywhere between 5 to 10 millimoles per liter is also a good target to be. When your blood sugar are falling within these targets, it means that your A1C, which is the 3-month blood sugar average, will be 7% or less, right? Because that means that you're managing your diabetes very well. Of course, different things happen, and because life happens and everything we do affects our blood sugar, you can manage your diabetes really well, but if there come a point where you're going through a lot of stress and a lot of issues, your blood sugar will tend to go up. So whenever you're under stress, you're not sleeping, you're in pain, your blood pressure is high, your blood sugar will also go high. If you gain weight, your blood sugar will also go high as well. So whenever we're doing these good lifestyle changes, when we're doing them well, it helps control our blood sugar. And then when things are not going so well, expect your sugar to be a little bit high, but as long as you're doing your best to control your blood sugar day to day, that will help manage your overall health and help you prevent complications of diabetes. When you have diabetes, it's very important for you to be in charge of your health. So this is why I'm telling you these numbers, because it's not good enough to say, well, my doctor's managing my diabetes. You should be the boss of your health, and you should know what's happening, because sometimes not that any healthcare provider try to neglect you, but they have a lot of clients, they might not see everything. So you should be the chief of your own health. So know what your A1C is, know what your fasting and your 2-hour blood sugar is. Do the experiment to see where you're at. If you're eating something new and you want to see how it affects your blood sugar, check your sugar before, and then 2 hours later check after to see how high your sugar went. If your sugar before and after there's more than goes between 1 to 3 points, that means what you ate is good enough. If it jumps more than 3 points, then what you ate, the food that contains natural sugar, is too much, so that can help you reduce the amount amount. So be in charge of your health. Make sure you're exercising. Make sure you're controlling your stress. If you are under a lot of stress, which life happens and stress happens, make sure you speak to someone to help you reduce that stress, because when you are under stress, our sugar will never be in target. It will continue to be high. So making sure that we're controlling our pain, we're eating healthy, we're eating a variety of food, we're including lots of vegetables and lots of and protein, and controlling the carb, the food that turns to sugar, controlling that amount, that help us overall be in charge of our health, right? So know where you're at in terms of your diabetes management, because diabetes affects everything. Think of blood flowing through your whole body. So wherever blood goes, sugar goes with it, because the sugar is in your blood. So diabetes can affect anything. If you're doing well and then at one point you feel like now your eyes is getting a little blurry, have it checked out, right? So when you have diabetes, you have to be very mindful, and you have to try to control what's happening. So making sure you're getting your eyes checked once a year to make sure that the sugar is not damaging your eye. Get oral care, so making sure you're seeing your dentist twice a year to make sure that your mouth is being clean, that the sugar is not causing any infection. Making sure that you're checking your feet, making sure that you don't have any cuts or anything like that on your feet. If you feel that the sensation, like how you feel things, has gone, the sensation has gone down where you don't feel things properly, let your doctor know. Your foot assessment should be done once a year by a chiropodist or by a podiatrist or your diabetes health team. So your doctor can do it, your nurse can do it, just to see where you're at in terms of baseline. And then if there's no nerve damage, once a year you go and get it checked, right? So when you have diabetes, it's important to look at the overall health, your whole head to toe, looking at everything to make sure that you are doing the best that you can to control what's happening in your body, because you have to be in charge. Know what your blood pressure is. If you have diabetes, your blood pressure should be about, the target is 130/80. We don't want it any higher than that, because that puts you at risk of heart disease, right? So knowing all these numbers, keeping your cholesterol in check, all are all good ways to making sure that we're managing our diabetes. So it's not just the diabetes that you're managing, just the sugar itself, but you're managing everything else that can essentially make the diabetes much worse. Of course, I'm going to do different more videos about the blood sugar target and what you should be looking at different points based on people's requests and questions. So this won't be the last you hear about diabetes. We're going to talk about the different parts, because like I said, diabetes affects everything. So we'll look at different sections and talk about different things that can help you stay in charge of your health and be the one that's driving how your health is going, being in charge of and managing your own health. So until next time, if you haven't subscribed to my YouTube channel, please do so. If you have any questions, please leave them in the comment section. I have a website called livingabalancedlife.com. I blog there where I put different healthy tips there that you can read to help you improve your overall health. Share with your friends this video and any of the videos that I've done in the past. There's a video on cholesterol, a video on pre-diabetes. Look at all of that to learn some tips that can help you keep you in charge and to take care of yourself and your family. So until next time, take care. Do your best to control your blood sugars. If you have any questions, let me know, and I'll gladly answer them either in a video or directly in the comment section. So till next time, take care and be in charge. Bye.
Exclusive.